Good afternoon and welcome to our latest briefing at AWP. Thank you for taking the time to listen. As usual, there will be people in the room that can take any questions, and we're really keen to start to link the centre of the Trust with our local delivery units. So going forward, we're trying to make sure that our directors link in with local areas. So there are three key messages for all staff today, and funnily enough, they actually come from the previous themes that have been raised in previous briefings, and it won't surprise you that they relate to people, to quality and to money. So if we start with the people first. So one of the questions that I've been asked, and I saw on our space, the question that was asked during last week's briefing, is so what happens when you leave, so when I leave our trust in the next month or so? Well, it's quite straightforward. The board has agreed to put some interim arrangements in place, and Dr. Hayley Richards, in the interest of stability and a smooth transition, has agreed to act in the post of Chief Executive. So that transition will take place in the next few weeks, and one of the critical things that will have to happen is that we appoint somebody to act as Medical Director in order that Hayley can be freed up to act as Chief Executive. And then the board has agreed that the more permanent arrangements will be made earlier in the new year. So as I said in last month's briefing, the most important thing from the board's point of view is that 1, we maintain the direction of travel, 2, that we have stability and focus during the transitional period, and 3, there is a smooth transition into the future. So that's the people. Second issue is in relation to quality, and the question that I've been asked is, again, when will the CQC be coming back to inspect our trust? And as we've said before, we expect that to be in the new year sometime. But what I wanted to mention in relation to that is the progress that's been made over the last several weeks, and in fact the introduction of the Quality Forum, which brings together the local directors of quality with the clinical executive and other clinicians from across the trust to help us to define and be clear about the certain standards that we need to see in each area. So for instance, I know that at a recent Quality Forum we're looking at standards around the management of ligature point in our trust. I know that we've been looking at things like privacy and dignity and making sure that we have a good approach to single-sex accommodation, etc. So the CQC will be back next year, but what we've got to maintain a focus on is ensuring that we understand the standards that we are setting for ourselves, and then we're achieving those standards. So our directors of quality will be working with our local teams to make sure that we keep working in that way. And then the final point today is in relation to the money, and I have been asked on a number of occasions in the last few weeks, are things getting tighter? And the truth of the matter is that yes, they are. The pressures on the NHS continue to grow. We're starting to see demands that we hadn't anticipated before, and the financial pressure in the trust is really significant. Now, part of the issue is we have still got challenges in terms of recruiting permanent staff, and we are still using a number of agency staff. So there is initiatives in place to help us to continually drive those agency costs down. And I think I've said before, one of the things that concerns me about using agency staff is they cost quite a lot more. They do quite a lot less than our own staff because they don't necessarily understand our wards and our teams. And it's poor in terms of quality because there's no continuity of care. So we're going to continue to drive down agency staff. And the way we're going to do that is we've moved to weekly pay. People had said, can we be paid weekly on the bank? We've now introduced that. So I would encourage our own staff perhaps to do some extra shifts for us. We are encouraging overtime over agency. And again, if you feel that you've not been offered overtime, whether you're community staff or inpatient staff, and you feel you would like to work some additional shifts, then do please speak to your ward manager. We've increased the hours that the bank, our own bank service operates. So by extending the hours, we've seen a significant reduction in the use of agency just in a couple of weeks. So again, it was suggested through the briefing that we extend the hours of our bank, and that's what we've done. So it's really important that everybody plays a part in ensuring that as far as possible we use our own staff. And the other thing I wanted to say in relation to agency, I recently worked on a ward in Wiltshire, and some of our staff said that we had agency staff on duty, but nobody was quite sure why. It's really important that we have safe staffing levels in the ward, but I'm really encouraging our ward managers to use discretion. If we have sufficient numbers of our own staff and we feel that we can work with one or two fewer staff than is indicated through our safer staffing levels, as long as the ward is safe, I would encourage that over using agency staffing. Now, the other thing that we're doing to make sure that we manage within our means is encouraging a reduction in any discretionary spend. So anything that's not essential, we're going to look to stop. So for instance, internal learning and development training will carry on, and I would encourage people to follow the courses that are laid on within the trust. But any events outside of the trust, any training, conferences, etc., we need to use very, very prudently, and as far as possible, seek to avoid the use of them. And then we need to continue looking at ways of reducing travel costs, etc. So I would encourage every one of us to look at how we can tighten our belts, how we can make sure that we, as far as possible, live within our means. And while the pressures around us are probably greater than we're experiencing ourselves, if we lose control of the money, we kind of lose control. So I'm looking for everybody to ensure that the difficulties that the NHS is facing are minimised within AWP. So as I say, the three things around people, we've got the transitional arrangements being put in place so that I can disappear and nobody will even notice. We will continue to focus on quality and make sure that our directors of quality are working with our teams to ensure the standards for CQC are in place. And around the money, I'm looking for all of us to look at how we can tighten our belts and make sure that we manage within our means over the last 4 months of this financial year. Thank you very much indeed.